So good afternoon, everyone. Welcome to our webinar today on Beyond the Financial Loss, Mental Health Impacts of Fraud in Older Adults. Today's webinar is being co-hosted with Elder Abuse Prevention Ontario, the Canadian Network for the Prevention of Ontario, and our speaker with the Canadian Coalition for Seniors Mental Health. So we're glad that you're able to join us today. Before we begin, I want to provide our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations, and we acknowledge their stewardship of this land and its waters as protection of its natural abundance throughout the ages. We seek a new relationship with original peoples of this land that remains their home to this day. May this relationship be one of peace and friendship, based in honor and deep respect. So we just have a few logistics to go through to optimize your experience through the webinar today. Because we have lots of people and our attendees' cameras and microphones will be turned off. We have our ASL interpreters with us today. They'll be on screen at all times. You can change the layout of the speakers and the ASL interpreters on your own screen by clicking on the little grid box on the top of the images of the speakers to choose the layout that you prefer. You can also enable the closed captioning on your screen. There's a little CC button at the bottom in the black bar where you can turn that on in your own screen as well. We do encourage you to post comments and suggestions that you want to share in the chat box. If you have a specific question for our speaker during the presentation today, please put that in the Q&A box. We will address those at the end of the presentation. We'll have time for that. As you can see, we are recording today's webinar, and it will be posted on both Elder Abuse Prevention Ontario's website and the Canadian Network website next week. Any of the links or documents and resources shared today from our speaker will also be posted along with that recording. And just lastly, we do appreciate your feedback. So if you could take a few moments at the end of the session to provide your input in terms of doing a short survey. There'll be a pop-up option. So we have different options for you to present. There's a pop-up, there's a QR code that we'll post, and then you'll also get an email notice after when we do post the materials onto our website, so you know where to access those. So your input, again, is important for us as we move forward, and other suggestions for topics is really helpful. As you are aware, this is a public event, so we appreciate your privacy and confidentiality. So if you have a personal circumstance or issue that you would like further assistance with, please reach out to either our organizations for a confidential conversation and we can further assist you. I put the phone numbers for Elder Abuse Prevention Ontario and the websites for both of our organization on the slide as well. And we'll post that in the chat box. So just to highlight the aims of our webinar today, that we recognize that financial fraud is increasingly recognized as a serious and growing concern. Yet too often, it's understood primarily through the financial and legal lens, overlooking the emotional and psychological toll it can have on older adults. So our speaker today is going to talk about the impacts of the financial fraud in later life, going to introduce some new tools that the Canadian Coalition for Seniors Mental Health has produced, both for older adults as well as service providers. We're going to explore approaches to reduce victim blaming while supporting the recovery to preserve dignity, autonomy, confidence, and hope. I would now like to turn it over to my colleague, Benedict Schifflin, who will introduce the Canadian Network for the Prevention of Elder Abuse.
Thank you so much, Rayan. Hello, everyone. It's very nice to see you all. I'm seeing a lot of people from BC, but not only, of course, but it's nice to see some familiar names. So my name is Benedict Schifflin. I'm the Executive Director of CNPEA, the Canadian Network for the Prevention of Elder Abuse. As some of you may know, we are a national organization that works to improve awareness, supports, and capacity so that we can develop a coordinated approach to the prevention of elder abuse and neglect across the country. So our work consists really in promoting the rights of older people through several avenues, which is knowledge mobilization, public education with events like today, policy reform, and we do this thanks to the many, many collaborations that we have both across the country and also across sectors. So today being an example. If you want to learn more about CNPEA or find additional resources or support services in your area, you can find it all on our website, cnpea.ca. And if you are the kind that enjoys social media, you can find us on most major social media at CNPEA. And now, without further ado, I'm going to introduce today's presenter, Claire Chackland. So Claire is the Executive Director of the Canadian Coalition for Seniors' Mental Health. She is a health advocate with 20 years of experience in government and stakeholder relations in not-for-profit. She's worked for the Canadian AIDS Society, the Canadian Cancer Society, and the Mental Health Commission of Canada. And as a side note, she also happens to be a stellar board member of CNPA, and we were very excited when CCSMH announced those new resources because we thought it would make for a wonderful webinar. So I think we'll just get straight into it. Claire, if you want to join us and share your screen, I'll go quiet. If you have any questions, let us know and we can give you a little vocal heads up at any point.
Super. All right, first obstacle, sharing screen and sharing it the right way. So here we go, presenter view. Okay, so hopefully you guys can see my slides, but not my secret notes.
Correct.
Okay, good.
Looking great.
Okay, perfect. So my notes are just slightly to the left of me here. So if I'm looking away, it's just because of that. But first, let me thank you guys for coming. This is the first time I've presented on this topic. It's something that's very close to my heart. And the more we've been talking about it as an organization, the more we see it's close to all of our hearts, as well it should be. So we'll get started here by hopefully if I go, okay, there we go. First, I'd like to let you know where I'm currently situated. I work from my home in the Ottawa region, the west of Ottawa, and that is the traditional unceded territory of the Algonquin and Anishinaabe Nation. My team, my small but mighty team, does span across Turtle Island, and we recognize and respect the enduring presence, cultures, and contributions of the Indigenous peoples who have cared for this land since time immemorial. I'm hoping some of you know the CCSMH a little bit already, but very high level, as our name implies, we are a coalition. Our focus is on seniors' mental health. Our vision is to promote the fact that mental illness is not a normal part of aging, and that all older adults have the right and deserve to receive services and care that promotes their mental health and responds to their needs. We are quite small. We and as such have had to focus in terms of our target audiences. We're positioned under the umbrella of the Canadian Academy of Geriatric Psychiatry, and have largely focused on trying to provide resources for healthcare providers across the country. We also try to develop and provide resources and evidence. So, like I say, to healthcare and service providers, community service providers, also to older adults and care partners as much as we can. And we do everything we can, as I say, as a small team, and our areas of focus are fairly broad. And feel free to take a look at our website to see what some of those areas are. For today, my intention is to have us all have this conversation around the mental health impacts of fraud in later life. I'd like us to explore a little bit the psychological and neurobiologic dynamics involved in scams. I think for us all, if we haven't already, to pause and recognize stigma and victim blaming responses that I think honestly all of us have from time to time when it comes to fraud, especially perhaps older adults. And I'll walk us through a few slides around more compassionate and recovery oriented approaches that we all can practice. And then I'll show you the first two tools that we've developed that are just scratching the surface, but they're our initial look at this topic, infographics. I often tell people that this is a topic that's come across my desk unintentionally. It's not one I was assigned. It's one that I was drawn to through passion and personal experience. Um, there are large personal experiences in terms of frauds that have happened in my family that have been really very disruptive and devastating. And then other smaller ones that weren't as devastating financially, but my insight into them and talking to my loved ones about them saw that the impact was broader than the finances lost. So in that case, a smaller example is my mother following a little bit of a pathway of a phone call and giving a few extra details to the person calling, and then immediately regretting it and getting some help. And in that case, she didn't lose any funds, but her thought to me afterwards was her solution was that she wasn't going to answer the phone anymore. And I just found that to be very sad and devastating, really, that her life was narrowing as a result of something somebody else had been trying to do to her. And that was unfortunate and can contribute to loneliness and isolation and various other things. I started poking around online a few years ago because when I was running my own, trying to do social media for the CCSMH, and I was trying to post something around Fraud Day that helped point people to help if they had been frauded. I looked at banks, I looked at government sites, I looked everywhere, and I couldn't find a single thing. And that got me thinking, in addition to my family's experience and loved ones' experiences, that there was a bit of a gap here. And then I did stumble across a paper written in the I think it was in the United States, called Blame and Shame. And when I read it, I couldn't help but start to think of the parallels between other crimes and some of the language that we've had historically around them and financial fraud and some of the way that we deal with it. So anyways, with that in mind, I tried to start a bit of a conversation, and we had an initial webinar last year where we mostly just chatted. And I've started to talk to healthcare and social service practitioners more about this topic, and there's been an increased interest. So these are just little images of the two infographics that we've created. They're both available on our site, and I'll tell you a little bit more about them later. But you can see one of them is targeted more at an older adult, and the other one's targeted more at service providers. I think I've already mentioned a little bit of this, but why this conversation matters. Fraud targeting older adults is increasing in sophistication and in reach. Older adults have reportedly lost $138 million in frauds in 2024 across 17,000 cases. And that's just those who are reported. We know that they're heavily underreported due to various issues and concerns that we'll talk about afterwards. Also, most coverage that I've encountered is around prevention, which is very important, of fraud, education around fraud, and reporting and recovering finances, which are all very important topics, but not ones that I'll be talking about today. The healthcare and social service providers that I work with and that I encounter every day, and that all of you do, whether you're community-based people or older adults yourselves, you're either experiencing fraud attempts, possibly have been frauded, or are hearing about these stories. So it's a wide-ranging thing that I think deserves conversation and sort of a little bit of a gathering on how to best support people. So the first part about mental health that I thought I would talk about a little bit is what fraudsters or criminals are doing, and the emotions and the mental health aspects that they're working to manipulate when they try to scam you. So obviously, there are things that are normal in our human psychology and wonderful. A lot of them are wonderful things that are sadly being reduced. Things like trust, hope. These are things that they can manipulate. Fear, our desire for attachment as humans, um, and so on. And I will say, as I've noted here, that this particular presentation is about the vast majority of older adults who are cognitively well and are being frauded. And I want to try to talk a little bit about it that way, although I do know that there are some important things to talk about when there are cognitive impairments or decline in place. But that would be another presentation, I think. This slide shows you some of the tactics that are taken and how they work and what the emotional impact can be. So in the case of triggering a sense of urgency, we've all seen or heard of frauds and scams that will have a sort of act now or lose this special opportunity kind of tactic. This, of course, can trigger a rush decision or reduced critical thinking. Some of the frauds use intimidation or fake authority. I know I received one not too long ago that said it was the CRA, the Revenue Agency of Canada, and it tried to trigger fear, saying that it was going to report me if I didn't respond to them. Some of these frauds, they're more in the area of creating a false sense of a relationship or connection. Of course, we've all heard of those, whether they're romance scams or grandparent scams that are leveraging your love for your grandchildren. And a lot of them work on embedding themselves in your daily life and providing you emotional reinforcement, things like affection and attention that many of us, that all of us want and desire. Many of them, like other types of abuse and crime, leverage isolation. They try to leverage feelings of shame or encourage secrecy. And that can, of course, reduce the likelihood of reporting, but it can also increase the likelihood of us feeling ashamed after these things have happened to us. As you know, many of them are becoming even more sneaky and having intermittent reinforcement. So you might think it's a little fraudulent, but then it does pay off, pays off a little. But then there's reasons why it didn't pay off in full, but you buy it, you think that that's legitimate, and so you lock in for a little bit more with the hopes that it's going to come back with more promise. It's an interesting story. As I say, those of us who are very cognitively well can be frauded as well. I was speaking to a colleague who's a doctor, PhD, very well-known, very intelligent person who talked about cognitive overload and how he was out with his loved ones, setting up for a skiing trip, trying to get them their boots on, trying to do all sorts of things. The phone call came through, sounded legitimate in terms of where he was in his life and what the people were saying. And he almost went the next steps with this fraudster until he phoned and had his wife call, in a three-way call, and his wife checked on him. And he admitted later that it was because he was overwhelmed. If he wasn't so busy that day, so tired and so on, it might have been different. So, as I mentioned, these tactics affect our neurology and they sometimes affect our biology. Stress narrows our decision-making capacity. Emotional arousal affects our judgment. Reward pathways and repeated contact can reinforce our ongoing engagement and our attachment like dynamics. They can help us feel loved. They can help us feel wanted, needed. But it's important to mention that vulnerability is dynamic and contextual usually. So that's to say that we can all be more vulnerable to manipulation under certain circumstances. And so then I'll talk to you a little bit about some of the risk factors. Some of these are a little bit more specific to older adults, and many of them affect all of us. A lot of us have been talking about loneliness and a social isolation of older adults. That's something that can be pursued or manipulated. Some older adults have recent bereavement in their lives. Some of them have transitions or losses that they've gone through in recent years and times. Increased stress as caregivers, financial anxiety, sometimes, not always, limited digital confidence. And then, as I mentioned, could be loss of sleep, grief, anxiety, all sorts of things that can increase your risk in that moment or at that time. Now, I'll talk to you a little bit about the mental health impacts, the immediate impacts when a person has realized that they've been defrauded. It can be anger, can be panic, anxiety, shame. They can lose sleep. They can be frightened, scared. And I think it's important to mention that those things don't go away, even if the money, the financial side of it has been recovered, which often it hasn't. There can be ongoing and longer term mental health impacts that may occur. It can result in a depression, social withdrawal, as I mentioned, as the example of my mother deciding no longer to answer the phone. You can have hypervigilance to the extent that you're frightened of encounters. And so, again, you're closing yourself off from opportunities and experiences. You can have a loss of confidence. You can question yourself, have a loss of trust. Even as bad as suicidal thinking, if some of those things line up and get you down a really bad path. We'll talk a little bit about shame, self-blame, and stigma. I think if we pause right now and honestly think about our responses, our internal, hopefully, responses to people who have been frauded, I would be surprised if any of us could say that they didn't have a little bit of a blame piece or a stigma or a victim blaming that might have happened. Well, how did she fall for that? What was she thinking? That sort of thing. Maybe she needs help. Maybe we should take over her banking. So I think some of those things obviously contribute to prevalence of victim blame. Many victims also internalize blame. The amount of people that I've talked to about this topic who have quietly, embarrassedly disclosed a story as though it was something that they were completely ashamed of is remarkable. I think there's something that we need to do to perhaps talk a little bit more about these things with strength, but also empower recovery. For older adults, I've put an asterisk around a fear of losing independence because that's an important topic that can be unique to older adults. Sometimes when a fraud has happened to an older adult, society's reaction or family or healthcare's reaction is to question their cognition and their abilities to do all sorts of different things. And so in some cases, there might be something happening that needs to be assessed. But in most cases, there isn't, and that we do need to work with the older adult to get through things. I put a quote here. It's a little bit long, but it was shared with me at a presentation by Dr. Joshua Wyman last year. And it just goes to show the depths of the impact of the crime. So it says, well, but really, they've taken away so much more because as an older person, it's what you worked your whole life for, and you can't get that back ever. But it's also the inheritance that you were going to leave for your children and your grandchildren that they took away too. The fraudster is taking away yourself. They are taking away your feeling of competency, right? Now you're getting old and you're looking in the mirror and you've got wrinkles and you've got aches and you've got pains and I need a new hip and I need a new shoulder. But now I thought I'm obviously not capable or competent either. Um, One of the clinicians that actually 2 or 3 times now I've spoken to different people who have talked to me about the impact of the fear of fraud. So that's a little bit of a different topic. Perhaps the person has not been frauded, but they live in fear of fraud because we're living in a society where it's everywhere and we're hearing about it all the time. And we're hopefully being taught to avoid fraud and to be as safe as possible and so on. And that fear can, again, narrow our lives and our experiences and can, in some cases, increase our dependency on others, which can also increase our likelihood of being victimized. So that's a bit of a problematic issue that I'd like to see us talk more about and see how we can address together. This piece here is about clinical or service, but also really just all of us, different things that we can do to support somebody who's been defrauded. Some of the things a healthcare practitioner or a social service person or a friend might see is an older adult expressing more anxiety, perhaps taking a text message or a phone call and expressing distress or urgency or panic after that contact. Perhaps they're withdrawing from social activities. Their sleep is changing. Maybe there's increased family conflict, a loss of confidence. So these are some of the things we might see in somebody who has not yet disclosed a fraud to us, perhaps, but that has experienced one. It's important to mention, I'm always trying to look at strengths-based arguments and aspects to the work that we do. And I think it's a fabulous thing that older adults, on average, show better emotional regulation and adaptability during crises. Older adults are often more trusting than the rest of us, which again is such a positive attribute. They often have more positive outlooks on life that I think many of us can learn from. But these things can be used against older adults by fraudsters. Being defrauded is a traumatic event. Those of us who are in service provision roles should try to respond to fraud in ways that we would respond to other crimes. So in a trauma-informed way. So trying to ensure safety, respect, helping with choice, collaboration, empowerment of the person who's been defrauded. And some of the ways we can support emotional recovery after fraud. This is another area I'm very interested in beyond fraud, just on trauma overall, is about early responses and getting in as quickly as we can, both having the older adult recognize the legitimacy of the feelings they're having and seek help wherever it's from, a professional or a friend or lots of things, but also having systems respond as quickly as possible. Quick response and appropriate response can help a person not, find their way back to health or not end up in a slope or a downward spiral to larger emotional or mental problems. So a lot of this will be obvious to you, but what we can do is listen without judgment, encourage social connection, help rebuild confidence, connect people to the right sorts of supports. Obviously, there is an underlying of need of support to connect them to, supports for financial supports and getting their money back. But as I said, this is more on the emotional side for this focus. These are some of the things that our internal narrative might say, but that perhaps there's a better approach to say when we're helping our friends or family or clients. That we can check our own language and our own assumptions and try to respond in a measured manner so that we can, as we would with other crimes. And then there's a similar slide, but I kept it in there because I feel it shows a slightly different angle. As I say, when a fraud has happened, financial recuperation is important. Reporting to the police is also important. And so, instead of focusing only on those things, though, there are some other bits that we can focus on. So the broader emotional, social, and situational context of what had happened, preserving the dignity, autonomy, and ensuring involvement in future decisions for the person, reducing shame and normalizing the manipulation tactics that had happened there. Yeah, just catching up, make sure I'm up to date with my notes here. Some more practical tools that a practitioner can advise on is to use reputable financial and identity monitoring tools that are set up at most most banks, to develop perhaps a personalized safety plan, including trusted early warning contacts, is something that could be considered. And promoting digital literacy and empowerment rather than digital avoidance, helping older adults stay connected, independent, and safer online. And I know there are lots of presentations on those sorts of topics in communities across the country, and I believe the CNPA and EAPO have done those sorts of presentations as well. So these are the resources, and our initial look at this topic was to start with the basics. So our first resource here, which you can download from our website, is around supporting older adults who were affected by financial fraud. And this one is targeted at service providers. So we developed this one just to sort of help bridge conversations, to obviously highlight the emotional and mental health impacts of financial fraud, and to help support mental health recovery after fraud. As I say, it's available online to anyone who would like to see it, and hopefully it sparks some conversations, and either in your offices or within your teams. The other one is targeted more at older adults, and it can be handed out by service providers to older adults, of course, or accessed by older adults themselves. And it just tries to put into context the crime that has happened, the fact that fraudsters are master manipulators, some of the impacts, sometimes several months after something's happened, if you're still not feeling quite right, it can be hard to firstly notice that, and secondly connect it to what's happened and to seek help, especially when you're ashamed of something that had happened. So this fact sheet or infographic gives a bit of a sense of how you might be able to start, and some of the things you might be able to start to help regain yourself and find your way back to wellness. I think there are opportunities, more system-wide opportunities, for us to do a better job at cross-sectorial communication. So financial institutions and policing and fraud services and healthcare and mental health providers. When I speak to healthcare and mental health providers, they're often not sure how to speak the language of financial institutions, and vice versa. We all are often siloed, and it's important that there are topics that we can come together on, that we can leverage each other's resources on, and we can advance together. A few of the things that I've been noting in the last little while in written submissions to government consultations that have been happening on this topic, when I try to focus on my mandate, which is seniors' mental health, is that, and I try to highlight things that could be done at different levels by, banks or insurance bodies or policing and so on, is creating warm referrals and warm sort of handoffs, coordinated responses. Even as I mentioned early in my presentation, when I was seeking a link for my social media post, having sites where you report a crime or you try to find out what to do after a fraud, having that site mention something about the emotional impact or where to get psychological support would be growth and change that I would love to see happen. We can work on reducing stigma and educating providers to recognize the mental health impacts and try to help people quickly. I think we can work on developing a stronger narrative around preserving dignity and autonomy and independence among people, and finding ways to reduce unintended harms of complex anti-fraud security systems. So what I mean there is sometimes systems have been put in place that are so complicated to access your own banking that you can't remember that password, or you don't have 3 different devices for authentication. So you hand it off to somebody for help. Um, and that can sometimes set you up for more risks. So that's an example of something that I think systems should try to look to. So I put this, or actually my colleague Monique found this starscape to reflect the feeling I've been having in tiptoeing outside of my sheltered health, not-for-profit, national world to try to meet with and create feedback and responses to banking codes at the federal level, or association or insurance firms that want to talk to me, or policing groups. And so I said that I wanted a slide that said, that I was, whatever that term is, about going where no man has gone before or something, but where no Claire has gone before, and admitting the discomfort we each have sometimes in trying to talk each other's language, but also the importance in hearing each other and finding out ways we can support each other. So that lists 3 submissions, 3 consultations at the federal level that have come up fairly recently that we have at my organization put feedback on. And I know that Benedict has as well for most of those, and many of those of you on the call might have as well tried to put some feedback there, just to make sure that the mental health, or in my case, mental health, but the broader aspects of these things are considered. So in conclusion, obviously, fraud is also a mental health issue. Vulnerability is contextual and human. Shame and stigma can deepen harm. Systems can either increase harm or support recovery. And recovery involves dignity, autonomy, confidence, trust, and hope. So we often point people to 211 because we often have people asking for resources in their own community, and we're too little to know all of that for everybody. But 211 can connect you with resources in your own communities if you ever want to look at that. It's amazing how many people are unaware of that resource, but we lean on it quite a bit. And then, of course, 988 is a national suicide crisis line that can be called from anywhere in the country if anybody is experiencing problems related to suicidality or distress or crises, and can get immediate help or support, or at least a listening ear. So that's a little slide about how to access us, but really it's ccsmh.ca. And that's my email address, or info@ccsmh for our organizational email. So I hope I'm doing good time. I'm not very good at multitasking, but
You're doing great. We have about 19 minutes.
Oh, good.
So we have plenty of time
Good, because
for
I definitely wanted to
questions.
hear, if people have questions, I'll do my best, but also just thoughts on the topic, what people are encountering, but also what sorts of things we might be able to do to help.
Of course. Well, so I'm going to encourage right now, everybody, if you have specific questions to ask, put it in the Q&A box, because there's been a lively conversation in the chat box, but unfortunately,
Good.
it sort of pushes whatever questions are put in there out of the way. So there was a lot of conversation really about people sharing their experience, saying that, yes, they are
Yeah.
getting targeted every day in every
Yeah.
way. Lots of questions regarding, and that might be perhaps a little bit outside of the scope of your expertise, but expertise. The responsibility or perhaps lack of responsibility and accountability of social media platforms
Mm,
when it comes to frauds and scams. I think a lot of people feel like it should not be possible
mhm.
for scammers to post, completely fake ads and questionable links to services that don't exist on social media. So I don't know if that's something that you've touched on in your work in any way, shape, or form. I just wanted
I
to flag
haven't, but
that.
I do know that the systems that are in place and structures that are in place to try to help with, I mean, that's one of many other issues like that. Those systems and resources can't get anywhere near keeping up with the sophistication of global, efforts. And that is definitely problematic. I mean, I think all of our countries can put more resources to these sorts of things,
Mhm.
but it is enormously, things are shifting and changing so quickly. But absolutely, these are some things that we should be pursuing limitations on to a certain extent. But that type of work would be done by brains beyond mine. I wouldn't know how to begin.
That's fair. But I wanted to flag that because that seemed to be a topic that
Yeah,
really resonated with a lot of people.
yeah.
There was a question that I saw go by recently regarding stats. Do we have any up-to-date stats regarding how fraud or how much fraud affects older people?
Yeah, I don't have it at the top of my head. And of course, they're just massively underreported. So but I think, I don't know if Monique's still on the line, but she would know the answer to that maybe offhand. But it's not as high a proportion. What I've heard is that um, older adults are not targeted too much more than younger adults and don't experience too much more, but when they are frauded, lose more money.
That's
That
correct.
there's a
Yeah.
larger effect financially and damage and lose more money, but also, of course, some of what I mentioned in my slides, but really brushed over was the impact of that loss. Of course, when you're 70 or 80 or 90 years old, can be very much more profound than when you're in your 20s or 30s and have a lot more sort of earning years left and ability to rebuild after a loss.
Yeah, it is, and you're right in terms of the proportion. So I was looking at that just recently, and I believe in 2024, older people who had lost money to fraud represented 21%
Yeah,
um, fraud victims, but they represented 28% of the total amount lost. So
yeah. But that's just reported too.
reported, exactly. And we
Yeah,
know that's only 5 to 10% of what actually happens.
yeah.
So
It's
the
mind-blowing.
numbers are likely much, much higher than this
Yeah.
for sure. Let's see, do we have any questions in the Q&A? Someone is asking. Okay, okay, more questions coming in. And any count for older adults that have defrauded without some healing and education, individuals are more vulnerable to being defrauded again.
Okay, you broke up a little at the beginning, but I caught the rest of it.
Ah,
So was it asking if people who've been defrauded in the past?
it was about recommending counseling services for older adults that have been defrauded.
Okay, one of us is freezing up. I think it's you. But I can't
Let me
recommend
let me turn off my camera.
okay. I think between the two
Uh,
statements I've caught the gist of it.
do you have a
Um,
recommendation for counseling services for older adults that have been defrauded?
I don't in particular. And, I would refer you to that 211 site because, I saw everybody putting in the chat where they're from, and they're from everywhere, which is fabulous. Um, so I don't have a specific recommendation, but you can, of course, check people's certification and that sort of thing when to verify, the quality of, a service provider and or go through a community resource that you trust that can refer you to somebody. And I'm not sure, Benedict, but I think you said something about being frauded repeatedly, which does happen, more often than one would like. And I don't know if there's a connection between, I would suspect there would be a connection between, some of those risk factors and them being remanipulated, but also, if we can better address together the person who is frauded and sort of service providers the situation after something's happened, then that hopefully would improve their likelihood of, not having it happen to them again, or at the very least, getting help very quickly when there's the first signs of something that might be troubling happening.
Thank you. There are a couple of questions regarding reporting. So essentially saying, how does one report if they are a target? Is there a cybersecurity helpline? Is there resources that kind of walk people through the kind of reporting that they need to do?
I think so. What I would recommend, that's also an area that I'm not an expert on, but I would obviously recommend most of us have a sort of community policing line that we can phone, not 911, but the other line, whatever that is for your community, and you can inquire there. The Canadian Anti-Fraud Centre has quite a few strong resources online that can give you advice and guidance about how to report. Um, and yeah, it says right here on one of our infographics on the back that I handily had printed here is yeah, the Anti-Fraud Center can give you a step-by-step instruction on addressing a fraud. And then there's the Canadian Investment Regulatory Organization, perhaps as well, but that could be a starting point. But as I say, your local police could be a starting point as well. Often policing have like an elder section that might have additional information for you.
Wonderful. There's a question that you might have an answer for. So I mean, it's kind of it sets it up as, sometimes when you go through a fraud and you go to your financial institution, they do not provide adequate support.
Yeah,
Even if there is evidence, sometimes it's not enough. You get referred to, collection agencies, et cetera, et cetera.
yeah,
And this in itself causes additional stress and frustration for the person who has already gone through a fraud. So the,
yeah.
the, the essence of the question is, how can professionals advocate more effectively for these clients in these situations? Because
Mm,
whatever your role might be, you might be assisting someone who has gone through this.
yeah.
How do you do that better so that they do not get re-victimized?
So I've had a few conversations, as I said, with that sort of space starscape slide with stakeholders outside of my norm in legal fields or banking fields and so on. And the ones that I've spoken to are aware that they are not bridging or addressing the emotional side of what's happened. They're also often feeling quite disappointed in themselves and their ability to um, go beyond the surface of, call your bank, just a few sort of cold statements. Um, and I don't think it's ideal for any of us to be sent on wild goose chases when we're in a high stress environment. So I think there's work that we all can be doing. And that's part of what I tried to mention in terms of our silos working together a little bit more, but also hopefully ourselves, by destigmatizing the issue perhaps a little bit, finding our way to reporting the crime and seeking the resources we need, but being less ashamed to be proactive in that pursuit. So whether we're service providers or people who have been frauded ourselves. So there's a few layers to that question, I think. But I do agree with the first part of it, which is because I've heard it from service providers themselves at banks and so on, at call centers, that they don't feel that they're doing as well as they could on that piece.
Wonderful. Thank you for this answer. We still have a few more minutes in case anybody has any outstanding or leftover questions. There were a couple of questions about the two-factor identification system. Two-factor identification system. But I don't know if that again goes maybe a little bit outside of the scope of today's presentation. I would say that is a tool that we recommend strongly to people as a way to kind of strengthen their protection against risk of piracy, fraud, and other forms of either money theft or identification theft online.
Yeah.
But I don't know if you have any particular anything to share about that.
No, I think my point on that, and he'll be embarrassed to know that he came into this presentation, but my own husband passes me his phone all the time when he hits some barriers, and I'm mostly trustworthy, but if he's doing it, it's probably happening in a lot of places, and so it's not. My comment wasn't about removing that. I mean, again, there's people with big brains who have decided that's the safest path forward in terms of proving that you are you and that's the decision you want to make. I think my point was more having those brains think about, what it means to different people, and how it translates to real life for different people. Like it probably helps the vast majority of people, but there's probably a certain percentage of us who end up getting, handing our phones or giving our PIN numbers and passwords to people, hopefully mostly who are trustworthy, but sometimes who are not, to get through the hoops to get, to access or do some of their banking. And I hope that that's something that is being considered, and that, there's ways that we're sort of doing our best and keeping those lived experiences in mind. I think that's mostly what I was getting at there.
That's a great answer. And I see there's more comments coming through, but I haven't seen any additional pressing questions. So Rayan, if you want to pop in and add a few closing words.
Yeah, I was also just going to say that we also hosted webinars in the past with Connected Canadians on many of these security issues that people are talking about,
Good.
including the multi-factor. So there are fact sheets from those webinars that you can find on our websites that might be helpful to have links and suggestions. I did just posted that into the website, into the chat box, and you can also find it on the CMPA site as well. So if you want to have a look there, that's also helpful. So thank you, Claire. It was a great presentation. Lots of questions, and it's difficult. Social media, people always have a new angle, even though people are trying to get ahead of the fraudsters. There always seem to be one step ahead of everyone. So I think it's important to have talk about the emotional impact, because it's not talked about as enough as maybe we have continue this conversation as well. So thank you so much. I'm just going to share my screen if you can stop yours. Yeah, thank you. So I just wanted to bring the attention that we do have another few events that are coming up. The big one is coming on June 10th. So both organizations with CNPA and EAPO are working with our partners across Canada to host our World Elder Abuse Awareness Day National Forum on June 10th. So it's the 20th anniversary for the WEAD, and we are excited about that. So please register. We would be more than happy to have everyone to join. More details about speakers are coming, but register early. We usually get quite a few people that attend that event. So, and June 15th is actually the day of World Elder Abuse Awareness Day. And we have many logos and resources and tools that you can download from the website to access that information, and social media posts that you can repost on your own social media organizations or individual Facebook accounts or Instagram accounts, etc. For those who are working in service provider services, that we have a training coming up next week on risk assessment. There's a few spots left, so if anybody's interested, you can reach out to our organization and we can see if we can get you started or get you signed up. And lastly, just a reminder about our evaluation. So thank you all again for participating. If you want to scan the QR code, that will take you to the survey. And when this webinar ends, you'll get the little pop-up to complete the survey. So again, we want to acknowledge and thank you for attending our event. And if you want to reach out to our organizations, both of our information contact is here on the slides. And again, thank you to Claire for your presentation. We greatly appreciate it. And we look forward to seeing everyone in the future. So, and also thank you to our ASL interpreters. As always, we appreciate your support. So until our next webinar, I believe on June 10th, we will see everyone then. So thank you again.